Okay, good morning, good afternoon, and good evening, wherever in the world you might be. And I suspect that for many of you, if not all of you, it's good afternoon and good evening, since we are doing this for our international students. Although some of you may be in South America, most of you are in Europe and in Asia. I'm Safwan Masri. I'm Executive Vice President for Global Centers and Global Development. And I'm really delighted that you are able to join us here. And I'm very, very grateful to my colleagues who will be introduced in due course, but I just want to acknowledge them, Trudy Kornfeld, Donna, Lynne, Wafaa, El-Sadr, and Melanie, Bernitz. And Melanie, Wafaa, and Donna form the trio that has really shepherded the university on campus and around the world through this incredibly difficult period of dealing with the pandemic. So we all owe them tremendous gratitude, unimaginable gratitude for the incredible work that they've been doing. And Julie, my good friend and colleague in the Provost's office, Vice Provost for Academic Programs, who's also on the faculty of the School of Public Health, is here with us, and she will be moderating the discussion with Donna, Wafaa, and Melanie, who will share some very important information that's pertinent to your preparation for your return to campus. Let me just say a couple of quick words. One is, on behalf of the entire university, I just want you to know how much we all look forward to welcoming you back to campus in September. We all miss you, we miss being on campus, and we miss having life getting back to as normal as possible. And it is really the efforts of the people that you see here before you that are making it possible for us to come back to campus and to have as normal an instructional experience as we can have. Secondly, the global centers have really been very proud this year to be working with colleagues to create for you, international students, the opportunities that you have had this year to try to mitigate some of the pain, if you will, and the difficulty of being away from campus and doing your studies online. So we're very happy to have been able to add 11 pop-up sites in addition to the 9 global centers, and to give you access to WeWork facilities in almost 90 cities around the world. We've continued with the initiative for this summer, so if you haven't registered, you may do so by going to the Global Centers website. And we are monitoring the situation with the help of Donna, Wafaa, and Melanie around the world to see where we might expect some students having difficulty coming back to campus, and we will continue to look at ways in which we can support you while you're away. And finally, this is part of programming that we've been working with, Julie and I and colleagues, to enrich your experience while you're away. And we have had a number of educational programs, including the University Leadership Series, which has had about a dozen deans, Julie, I think, speak to our international students. That continues into the summer. And today's particular webinar is part of a vaccination series that we have been doing on a monthly basis. And that series itself is part of a Returning to Campus series, where we are trying to bring you important information that hopefully will help you in your transition to campus. So my salutations are to you, and please keep us informed of your status, of your plans to come back to campus. Let us know if there's anything that we can do to help you before you get to campus, and certainly once you get to campus. Please use the Q&A function to post questions, and we'll try to get to all of them. And with that, again, my thanks to all of you for joining us today, and to my colleagues, and I'm going to turn it over to Julie. Julie?
Hi, thank you so much, Safwan. I want us to jump into the panel because I know everyone here is anxious to get an update on what's happening with respect to vaccines, as globally as well as in New York, and more importantly, what are our plans for health and safety in terms of a safe return to campus, and you're going to hear a lot about that today. I'm going to quickly introduce officially our panelists and then turn things over. As Safwan said, please do put questions and answer questions in the Q&A button. We will do our our best to answer them in real time, and I will try and make sure we've gotten to all questions at the end of the three panelists' presentations. And I'll say a few words about our academic plans at the completion of the three presentations. So without further ado, let me just quickly introduce you. We'll hear from Dr. El-Sadr, University Professor of Epidemiology and Medicine and Director of ICAP here at Columbia, Donna, Lynne, Senior Vice President and Chief Operating Officer of CUIMC and our University COVID Director, and Melanie Bernitz, who's our Associate Vice President and Medical Director for Columbia Health. So I'm going to turn things over to you, Wafaa, right now.
Great. Thank you very much. Can you see my screen? Okay, terrific. Thank you. So I'm going to give a very brief update today on the status of the pandemic, but also with a specific focus on a couple of topic areas. One is the issue of the vaccines, available vaccines, then the variants, and then the question of boosters for vaccination. So quickly, as you are, I'm sure, aware that there continues to be an increasing numbers of cases around the world. Now more than 186 million cases have been confirmed and more than 4 million deaths. And as you can see here in the right upper hand corner, these are the countries that are reporting the largest numbers of cases: the US, followed by India, Brazil, France, and Russia. And most of the cases continue again to be reported thus far, if you cumulatively from the Americas and from Europe, although there are some parts of the world that are experiencing surges at this point in time. So where are these surges occurring? And this is a map that shows the hotspots. These are the average daily numbers of cases per 100,000 persons in the past week. So this is recent. These are the recent data in terms of cases. And you'll see here that the darkest colors of red are where we have the highest rates. And again, you can see in South America, several countries in South America, there's a surge ongoing in Southern Africa, as well as several countries in Southeast Asia and in Europe as well, and Asia. So, so that's the situation as it is now globally. In the US, fortunately, as you can see here in this curve, we are now at low numbers of cases, daily numbers of cases in the US. And similarly in New York City, in this curve here, the blue one, you can see also the low numbers of recently reported cases. But again, whether it be in the United States or in New York City, there are extensive variability in terms of what's happening with the epidemic in the United States, within cities, within states, and between states. And that's largely now impacted by the uptake of vaccination. So where are we at with vaccines? Since the last webinar we did, there hasn't been really any change. There are 3 pre-qualified or authorized vaccines in the United States by the FDA. Here they are, and the Pfizer, the BioNTech, the Moderna, and the Johnson & Johnson Janssen vaccine. And they're the same 3 vaccines that have been authorized by WHO: AstraZeneca, Sinopharm, Sinovac. There are several other vaccines that are under consideration by WHO, but they've not been authorized as of yet. And this is important because, as you'll hear from Melanie, it is these vaccines that are on this slide here that are considered now acceptable as evidence of vaccination by Columbia University. Now, how are we getting to vaccinations around the world? This is vaccination per 100 persons. The darkest greens mean highest rates of vaccines. The lowest green means lowest rates of vaccines. And you'll see again, quite the disparities again between countries, and as mentioned before, within countries, with the darkest green, again, several countries in North America, South America, in Western Europe in particular, and in China and several other Asian countries that have vaccinated more of their people than other countries around the world. And you'll notice, for example, the continent of Africa, very limited vaccination has been ongoing in that whole continent. So I'm going to shift now to variants. And as you know, there are 2 kinds of variants of the virus, which are strains of the virus. These are new strains of the virus that emerge as the virus multiplies, as it jumps from one person to the next and multiplies. There are variants of interest and there are variants of concern. And just to give you a very brief definition so you know what we're talking about, so the variants of interest are the strains that have some kind of genetic marker that can predict that may affect transmission, may affect the ability to diagnose the infection, or the effect of vaccines, or the effect of treatments. So it's just that they have these genetic markers that may predict this. And then also the other definition is there's evidence that is increased proportion of cases, which means that it's evidence that it is more transmissible and that it is a limited prevalence or expansion in countries. Now, on the other hand, the variants of concern are where we already have evidence of impact on diagnostics or treatment of vaccines, either in terms of reduced vaccine-induced protection, increase in transmission, or increase in severity of disease. So, of course, we are much more concerned about variants of concern because they already have demonstrated some evidence that they're affecting our ability, they're affecting transmission and may affect other aspects of the disease of COVID-19. So this is to show you the Delta variant and its prevalence around the world. And in this map, the darkest colors are, again, the countries with highest numbers of confirmed cases of Delta variants. So in the darkest brown, like, for example, the United States and in India, there are more than 5,000 plus confirmed sequences of viruses that actually belong to this Delta variant. But you can see that this variant, which was first identified in India, has rapidly over the last couple of months actually now been identified in many, many countries around the world and responsible for variable numbers of new infections. And what we know about the Delta variant is it appears that it has increased transmissibility, meaning it's easier to transmit it from one person to the next. And this just shows you here the change in transmissibility here. The higher up means higher transmissibility. And you can see these various variants that you may remember that you've heard about before. And again, you'll see here that the Delta variant is right here, and it's the highest one compared to the others in terms of evidence of transmissibility. So we know that the Delta variant is more transmissible, but we also know that many of these variants that we've heard about before have also evidence of increased transmissibility as well. But most importantly, I think, is the question, of course, of the effect on disease severity, the risk of reinfection, and vaccine protection. And probably, again, the most important aspect of what we know thus far is that we don't have any evidence of not confirm of increase of an effect on increasing severity of disease, and also there. And while there has been a decrease in this neutralizing activity of the antibodies on these variants, we seem to have evidence from several countries now, real-world evidence that there's protection is retained by the vaccines against severe disease. And while there may be some possible reduced protection against some symptomatic disease or infection. But most importantly, which is what we worry about, is that the vaccines that have been looked at thus far, several of them have shown that they retain protection against severe disease. And lastly, touch on booster doses. This has come up again and again. And what we know thus far is that the durability of protection appears to be longer than what we feared. So the research indicates that, for example, mRNA vaccines, the Moderna and the Pfizer-BioNTech vaccines, they maintain more than 90% efficacy 6 months after vaccination or even longer. We have now evidence that the immunity may last up to a year or more. This is as long as they've been around. So this is encouraging data in terms of durability of protection. But it's predicted that, of course, like with any vaccines, that this immunity may wane, and there may be the need for a new booster, whether it's in a dose of the original vaccine or a new vaccine may be needed against a new variant. And many vaccine makers are now currently conducting studies to develop these booster vaccines, and several of them have already released data. Pfizer, Moderna, and AstraZeneca have all released data, positive data from their booster studies. But according to the CDC and most experts, the need for whether we need booster doses and the timing of booster doses has not been established, and at present, no additional doses are recommended. And that's it for now. Thank you very much. And I'll stop sharing and hand it over to Donna. Thank you.
Great. Good morning, everybody. Give me 1 second while I share. I'm on a different computer today, so it's always challenging. Here. Let's go to, can you see that? All right, great. So as you heard from Safwan and Julie, we're segmenting this presentation really into 3 components. I'm going to try to give you a sense of what does life look like on campus, and then Melanie is going to share with you what are some of the things that you need to do as you prepare to come back to campus. So as Wafaa said, and part of this is hoping that you're seeing some of this information, but you may not, depending on what your access to information is in the countries that you're at. But the US has done a pretty significant job in terms of vaccine distribution and administration. There's over 300 million doses, that have been administered. The president had set out a goal of 70%. We're a little short of that, although I think there are about 20 states where, in fact, the 70% has been achieved, and that includes New York State. And much of the work that we've been doing while you've unfortunately been able to be on campus is to try to keep the campus safe, whether it's through testing, physical distancing, and vaccine administration. And I'll share with you some of the work that we're doing here and that you'll be able, if you're unvaccinated, to have access to. So in New York State, we have about 18 to 19 million people here. We have achieved, as I said, more than 70% of the population having 1 dose. It's very much concentrated in certain zip code areas, as you can see. But our Morningside Heights and Upper West Side communities and even into the CUIMC campus have seen great success. The darker the color, the more penetration there is in terms of adults having their first dose and their second dose. So you can see there are some pockets of the city that are lagging behind, mostly in sections of Brooklyn and Queens and one area in the Bronx. So you should be aware that we did issue a vaccine mandate for our students in April, followed fairly quickly by a mandate for faculty and for staff. We encourage you to get vaccinated in your home country, but if that's not possible, it's okay. We are asking, though, if you can do that, to submit your vaccination information by August 2nd. Melanie will go through with you the how to do that through student health. We do think the mandate is important. We're not alone in the United States in doing this. In terms of colleges and universities, an overwhelming number of colleges and universities have mandated it for students and even for faculty and staff. I will tell you, amongst the employed population, however, it is very unusual in the United States right now for there to be a vaccine mandate, and a lot of debate about that. But we feel very confident that protecting the health of our community is so important that a mandate is in order. If you look at something, hopefully you will get to a point where you will download something called the Reopen CU app. That is your entryway into the university. It allows you to log a number of things, from the fact whether or not you've taken training, you've signed something that we call the Health Compact, which all of us sign in order to be on campus. It really attests to your willingness and support of the many different changes that we have on campus. And particularly for those who are unvaccinated when they initially arrive, or because of medical or religious reasons need an exemption. As Wafaa mentioned, those 6 vaccines, 3 of which have been approved by the FDA and 3 of which have been approved by the World Health organization are acceptable vaccines for you to have. We will vaccinate you on campus if you've been unable to get access to any of those 6. And we'll do that as soon as you arrive and provide you the ability to come into classroom and other environments as that transpires over the several weeks that you need to become fully vaccinated. We have been masking on campus, or we are face coverings, which we do provide to you. And in addition, and I'll show you a wonderful slide that Wafaa and her team put together that shares with you the different time periods in which masking or face covering and distancing are required. But beginning September 9th, if you're fully vaccinated, you will not need to either do the physical distancing or wear the face covering. The only exception is when you're in a healthcare setting, such as I'm on the CUIMC campus on 168th Street, in patient-facing and clinical research-facing environments, you do have to wear face coverings, as well as in some of our common areas, because we have so many people who do interact with patients. This is what, as I mentioned, our Reopen CU app. The main component of that is something called Symptom Attestation. Melanie will walk you through a piece of that. But basically, there's really 2 components to it. The first component in the upper left-hand corner of the screen is a daily attestation. So we want to check and see how you're feeling and if there are any symptoms related to COVID or otherwise some exposure to COVID. And then the second selection, which is called My Checklist, is a one and done kind of an activity. The daily attestation is done every single day as any of us come onto campus. The checklists are a series of things from training to signing the compact that I mentioned before, meeting the testing requirements, as well as completing the vaccine requirements. So a lot of things have changed, as I mentioned. For certainly the spring term, the substantial amount of classes were held remote. There were some that were held in other fashions, hybrid and high flex, and there were even some that were held in person. But we are preparing for September 9th and the return of 100% of the classes being offered in person, our faculty being back in person, staff being back in person. And quite frankly, this is not an empty campus right now. There are many thousands of people who do come in every day to do their work and to prepare for the upcoming fall. The dorms are going to be 100% open. Meals will be served. The libraries are open, so that this is a full return to campus based, as I said, on all the safety measures that we have taken. And one of the things you should be aware of is that the CDC, but also the state of New York, have been very involved in approving our university campus policies. And they have taken a series of actions literally just over the last month that have also impacted our ability to have a fully present campus. So the first is we were concerned about our ability to have a full in-person learning environment. On June 4th, the governor allowed us to do that. He also, provided some guidance on the summer. And most importantly, on June 15th, a little less than a month ago, once New York State hit that 70% of New Yorkers being vaccinated, many of the distancing and masking requirements outside of the university campus were changed, so that going to venues like baseball games and concerts and so forth are now possible in New York. The last thing I just want to share with you, and this is on our COVID-19 website, please refer to that as often as you can when you have questions. We're going to answer some of the questions that you've posted. But the important part is we're in a transition phase. And the transition phase, I think, for most of you will be applicable for the last 2 horizontal columns one of which is from August 3rd until September 8th, and then beginning September 9th. September 9th, we anticipate having a fully vaccinated campus, and that will allow vaccinated people to no longer wear masks, as I mentioned, and to no longer do distancing. We still will have unvaccinated people on campus, both as they transition in terms of getting their 2 doses of the 3 vaccines that the FDA has approved if you were unable to get it in your host country. But, and there still will be people wearing face coverings, as I mentioned, on campus, either because of preference, because they've gotten an exemption, or because of the location. We also have expanded the capacity of many of our venues, and we'll continue to do that throughout the fall, as long as public health conditions allow. With that, I'm going to stop, and I'll turn it over to Melanie to tell you how you get all these things ready before you arrive back on campus.
Great, thank you, Donna. Hopefully you can see my screen and hear me. Good morning, afternoon, good evening, everyone. Great to be here with you all today. I'm Melanie Bernitz, and I oversee the student health services on the Morningside campus, and I've been working with Donna and Wafaa as we've gone through the last 18 months. So I have been answering a lot of questions in the chat, and I'm going to try and address some of the ones that seem to be coming up frequently as well here. But again, just to emphasize and to follow on from what Donna and Wafaa shared, our campus picture has been throughout a lot better than the New York City situation. We've done now over 275,000 tests on campus. Our cumulative positivity rate is only 0.33%. We continue to do our random surveillance testing. Actually, the last 4 or 5 weeks, our numbers have been at 0%. So far below even the low ranges we're seeing in New York City. And I hope that gives you reassurance as a strong indicator of the safety of our campuses as we continue to welcome our students, faculty, and staff back. We have a robust contact tracing program, so if we do get positive cases, and we do expect to continue to get positive cases, our team is able to respond rapidly. And we know that our ability to respond so rapidly prevents further transmission. I always direct everyone to the resources. The covid19.columbia.edu website really has so many of the answers to the questions. Please go there, bookmark that site, and look for the answers to your questions. There's a lot of FAQs. There's actually a chat bot, and the data that we show you is updated in real time. And again, I just want to share the process that we go through to adopt guidance. We review any of the global guidance and then the national that is sent through CDC. Then this goes to the state level, to New York State, and then New York City, and then we make decisions at the campus level. So we use all of these to inform our response, and this has been a very successful approach and one we're going to continue to use as we move into the fall. We know that this has allowed us to avoid any mass quarantines, keeping our campus open and ensuring a safe environment. So Donna mentioned the daily attestation. I tell everyone this has become as familiar for many of us as brushing our teeth in the morning. And it's what we do every day before we come to campus. It really is part of the daily routine. We keep adapting it as the situation changes. So we ask that you look at it and that you answer honestly where you are on campus. It's 3 simple questions right now to answer every day. It's asked if you've tested positive within the last 14 days, if you've been in close contact within the last 14 days, or if you have symptoms, or none of the above. If none of the above applies, you check that and you get the green pass that you see here. If any of the others apply, you get a red pass and guidance as to what to do next. Below that submit button, when you do download the app, you'll see the checklist. And there are now 4 aspects of the checklist. Signing the compact, you can do that within the app. And you can, if you're not able to download the app till you arrive in the US, that's okay. That's something very easy and quick to do as soon as you're able to download the app. And once you sign that compact, that checkbox is marked. The training is being updated, and you'll be able to access that quite easily as well. The testing requirement I'll talk about in a moment. Right now, it is not linked to the Green Pass and won't be till September 9th, so that allows you time to get that done. And then obviously we're going to talk about the vaccine requirement. So just testing, because I've been seeing these questions coming up. We have been doing testing since last summer, as I mentioned, and we continuously refine the testing program based on the data we're seeing in New York City and on campus. We have high throughput testing centers, one on the Morningside campus and one at the Medical Center campus. And we can routinely do 3,000 tests a day if we need to. So don't worry about getting appointments. There'll be adequate appointments available. Regarding appointments, we only open those a week or two in advance. So if you're looking right now for appointments at the end of August, you won't see them. Don't worry. It doesn't mean there's nothing available. As they say, check a week or two beforehand and you will be able to get an appointment, no problem. So for the fall, we're requiring what we call a gateway test, a re-entry test. This is nothing special about this test, except it's the first test that you ever take with us, and it has to be a test with us. The requirement for a gateway test is for anyone who hasn't accessed campus in 2021. So if you haven't been here, you will need to get that test done. If you're vaccinated, you can do that in advance of your return, or we ask you do it within 14 days of your return. If you're unvaccinated, we prefer it's done prior to your return, but we know for many of you, you return the day you're moving into our housing. That's okay. Get it done on the first business day, but you will need to quarantine if you are unvaccinated until you get the result of that first test. Or if you're undergoing a mandatory travel quarantine, which I'll speak about in a little while, that will count. Your travel test will be the same as your gateway test. So just the first test needs to be done. If you're unvaccinated, as they say, do it. You'll have to quarantine while waiting the results. If you're vaccinated, do it as soon as you arrive on campus. That's the gateway test. In terms of what happens after that, we do have ongoing surveillance testing. This is changing as we move through the summer. So depending on when you arrive will depend on what kind of test you have done. But basically until September 8th, anyone, there are two different groups. Unvaccinated individuals are getting tested either twice a week right now. Between August 3rd and September 8th, they'll go to weekly testing. And the rest of our population falls into what we call the random sample. So if you are vaccinated, you may be selected periodically to have a required test. And if you do get that email asking you to be tested, you must comply with that. After September 9th, anyone who is unvaccinated because they are either still completing their vaccine course or they have an approved medical or religious exemption will be required to get a test every week in order to retain access to campus. So the two pieces of testing are the gateway test and then the ongoing surveillance testing. And again, slightly different depending on whether you're vaccinated or unvaccinated. I should also add that as you return, there is, and I'll talk about this shortly, there is a required travel test, and that is something we can do in our testing centers. So moving on to the vaccine, as the others have mentioned, we do have the vaccine requirement. We are very fortunate in the United States. Vaccine availability is very easy and everyone over the age of 12 is eligible to receive a vaccine. So if you're already in the US, please ensure you get your vaccination as soon as possible. And for those of you who are international, we know that vaccine availability is very different depending on where you are, and the kinds of vaccines are different. We recommend you get vaccinated as soon as possible with whatever is available, even if that is not something approved by the World Health Organization. We can revaccinate you when you get here, but obviously it's important that you have protection in your country where you are at until you come back to Colombia anyway. So a little more information, how to complete the vaccine requirement. So by August 2nd, we ask that everyone upload their documentation, knowing that for some of you that may be partial documentation, and that's okay. And we'll talk about what's going to happen after that date. As has been mentioned, we accept the vaccines that have been authorized by the US Food and Drug Administration. That's the 3, Moderna, Pfizer, Janssen, J&J. Or the vaccines that have been authorized by the World Health Organization. We know that the World Health Organization is continuously reviewing vaccines. So some that right now may not be approved, may be approved by August 2nd. So that's why it's important that you upload regardless, because that situation is changing, and we will continue to allow those as they get approved, even if it is at a later date. When are you considered fully vaccinated? That's 2 weeks after you complete your course. So for 2-dose vaccines, that's 14 days after the second dose, and for the Johnson J&J, that's 14 days after the single dose. And then important to upload that vaccine documentation. What documentation works? It's really any of these listed, the CDC vaccine card if you're in the United States, World Health Organization booklet, or any documentation that you're given by the vaccine site, so long as it has on your name, your date of birth, so we can identify you, the vaccine you received with the lot number and the dates of vaccine administration. And so just upload that. If that documentation is in another language, please provide a certified translation as well so that we can verify your vaccine. So in terms of the dates, we've added these to try and help you kind of figure out the timing. Hopefully, if you're receiving the 2-dose vaccines that are a month apart, you've already received your first dose. Pfizer, today, if you're going to be able to hit the August 2nd deadline, is the last day to receive dose 1, and August 2nd, obviously, for single doses and the upload. In terms of applying for a religious or a medical exemption, those are the only 2 exemptions we are reviewing. Please use the same portal to submit not only your request and your personal statement, but your supplemental documentation, and all of that is laid out on the website. It is, as you can imagine, we are looking at a lot of documents, so as soon as possible if you are requesting an exemption. It's also important to know, even for your regular uploads that you are doing. These are going through your student health portals. For the Morningside students, it's the secure.health.columbia.edu portal. CUIMC, please go to their website and look at their link for that. Upload your documentation through the medical clearances part on the Secure Health portal. You need to not only enter the dates of vaccination that you received, but also submit the vaccine documentation proof that I just reviewed. We need both of those in order to process your records. As I mentioned, we're getting thousands and thousands of records. So it is taking about 2 weeks to review these records. So don't panic. There's 2 ways you'll know that your records have been reviewed and approved. The first will be that you can go into your immunization section on the portal and you can see the approval there. But once they are approved, we do then share this information with CUIT, and you will get the checkbox in your app. So it does take a couple of weeks, as I say, go into that medical clearances section to upload, and then give us time to process your information. This was just some more information on the religious exemptions. As I said, complete the forms, submit the documentation. We do review all requests for medical or religious exemptions, but we don't necessarily approve them all. Obviously, there are criteria that have to be met, and we will notify you of the determination once that approve has happened and it is done by a committee at the university. As I do want to reinforce, medical and religious exemptions are looked at. We do not look at personal or philosophical exemption requests. So just, I think Donna shared some of these. So just to reinforce how we are going through these 3 different phases. Once you arrive, hopefully sometime in August, we'll still be in this mixed state. So everyone is still required to mask, even if vaccinated, and to test. And then after September 9th, indoor masking is only in certain areas. In most classroom settings, for those who are fully vaccinated, we anticipate not having to mask, but we will continue testing. Those who are unvaccinated, and we do know that for some of our international students, there will be a period of time where you are not fully vaccinated, you will continue to mask and test as needed until you are fully vaccinated. One question that I did see coming up was around what happens if you have been unable to access vaccine in your home country. Will you be able to access campus? So let's talk about that in a moment. Sorry, I'm ahead of myself here. These are just reminders on some of the dates in terms of uploading by August 2nd, signing your compact by August 16th. Obviously, if you arrive after August 16th and you haven't been able to download the app, do that as soon as you arrive. Same with the training, once you can download the app, and then obviously the testing requirements by September 9th, the gateway test as soon as you arrive. So the travel and quarantine. And this will then I will emphasize about what happens if you're not vaccinated. So if you're already in the United States, there is no quarantine required for anyone who is fully vaccinated, no testing as well. If you are not fully vaccinated, we still recommend, even for domestic travel, testing before your trip and after your trip, and quarantining. It is different for international travel, and this has been a recent change because New York State changed their travel advisory and now refers to the CDC advisory. If you are coming into the United States and you are fully vaccinated with a CDC or World Health Organization approved vaccine, you are required to test 3 days prior to your travel. So the 3 days prior to travel is required for everyone, regardless of vaccination status. That is to get on to a flight into the US. If you're fully vaccinated, we require a test 3 to 5 days after you arrive. So that can be your gateway test here, and it is required. But you do not need to quarantine if you are fully vaccinated. If you are not fully vaccinated, and we know that may be the case for some of our international students who haven't been able to access vaccine, may have only had 1 dose, or have had a vaccine that is not approved by the FDA or World Health Organization, you are again required to do that test 1 to 3 days before your trip, and then 3 to 5 days after you travel. You are required to quarantine upon your arrival. And you can do that 3 to 5 day test during your quarantine. You can do that at our testing site, and that will also count as your gateway test. And as when you do that test, then your quarantine is only 7 days. If you don't test, you have to do a 10-day quarantine. But because we require everyone to test, we think that everyone should just be doing the 7-day quarantine. In most cases, you should be able to move into your housing and do the quarantine there. Obviously, there may be some situations where that is not possible, but in most cases, we anticipate that that will be possible. And again, this will be true for those of you who have not been able to complete your vaccination in your home country. So you will test before you come, you will test when you arrive, you'll quarantine for 7 days, and then you can start working towards becoming fully vaccinated at our vaccine sites. So hopefully I clarified and didn't add more confusion there, but I can certainly answer questions and clarify as needed. As a reminder, we do have support for you through our medical services, counseling services, and health promotion services on both campuses. Be sure you reach out even before you arrive, and we will be available for you when you return to campus. There's lots of offerings, so please check those out. I will stop sharing and turn back to Julie.
Thank you. That's a lot of information, I think. Thank you, Melanie. There are a couple other questions. I know you all are answering them. I'll try and circle back to a few that keep coming up. Let me just say a little bit about academics for a second. And I did try and answer a few questions in the chat on this. So I think, as you all have heard, we're working very hard to ensure that you can make a safe transition back to campus. It is our intention for all students to be in person, and we are fully welcoming you back to campus. We do understand that some international students will be delayed due to circumstances beyond their control. So this means that if you have visa appointments that are delayed, or you have other reasons that you can't get here right at the start of the semester, you will need to contact your program as well as ISSO, and you will need to let them know what your plans are. We are, again, going to be in person. So not every class and not every program will offer remote classes. What many programs, particularly those with large proportions of international students, are trying to do is accommodate those students, again, who have delays arriving in this country and arriving to Columbia, and that there will be some high flex or remote options for up to 30 days. So our first day of campus is, return to campus is September 9th. So up to October 9th, many programs will be working with you. Everybody's intention is to allow you to advance academically while you're experiencing delays. If you are in this country already, we need and fully expect you to be here on September 9th. So this does not apply to students who are already in the US, maybe in another location in the US, but if you're here in the US, we expect you here and in class and in person on September 9th. So again, I urge you to reach out to your programs if you have specific questions about what will be available to you and you have experiencing some delays. We're very heartened by the updated information about consulate openings both in China China and in India. And we know that many students are able to get their appointments now and to get their documents processed. So we're very happy and pleased to hear that. We do know that in South America and even in some places in Europe, there still are some delays. And if you're experiencing those delays, please be in touch with your program and also be in touch with ISSO so that we're aware and we can help you with your academic planning. So I just wanted to add that, and I'm going to turn, there are a couple questions that I've seen repeatedly. I know Melanie, Donna, and Wafaa have been frantically typing answers to your questions. And in our last couple of minutes, I want to try and address a few that I've seen a few times. Wafaa, perhaps I can direct this to you in terms of safety of revaccination. I've seen that question come up a few times for those people who've been vaccinated with those vaccines are not either CDC or WHO approved.
Yeah, yes. And the answer is, I think there has not been a study specifically looking at this question. But I think based on what we know from other studies, like for example, there have been several studies, like I mentioned, that have used booster vaccines, sometimes a booster of a different vaccine, and those have been shown to be safe. So I think what we can say now, we can extrapolate from those studies that it is likely to be safe to be revaccinated with one of these authorized vaccines. So that's, and also just keep in mind that this is what the CDC is currently recommending for those who have received non-authorized vaccines.
And when you arrive here in Colombia, you'll be able to make an appointment for those authorized vaccines, even if you've had.
Yes.
Right. And I think the other thing, as Melanie mentioned, is important for people to keep watching the website because some vaccines may be approved between now and the time that you arrive. So do keep watching that. And as Melanie said, I think to please upload your documentation so we have it should that vaccine become approved and you're not rushing to get that documentation uploaded. I think the other, there's some questions, I think, Melanie, about exemptions. Could you talk a little bit about the necessity of having your gateway testing by at a Columbia facility? Because I think that's a question that people are raising in terms of where they get their testing when they arrive in the US.
Yes, so just to clarify, obviously the test before you arrive in the US is done wherever you are, and just to the US is accepting both PCR and antigen tests prior to arrival, 3 days prior to within 3 days prior to your departure. But the gateway test, the first test at Columbia, has to be done at one of our sites. We don't accept it if you do it at CVS or another testing site. So it must be at one of our sites. And just for convenience sake, we recommend if you are quarantining and you're going to do that day 3 to 5 test, just do it with us. It counts for both requirements, your 3 to 5 day post-travel test, as well as your gateway test. But we don't accept outside tests. So you won't see your gateway test box requirement complete until you do a test with one of our facilities. The reason we do that is because it is a PCR test, it is a good test, and we have everyone having that same first test, so we understand our situation on our campuses.
Melanie, can you mention where those tests will be offered?
Yes, so there are 2 main sites for those. First is at Lerner Hall in the Morningside campus, and CUIMC. Currently it's at the Black Building. If there is a location change, we will notify, but there is a site up at CUIMC as well. Those appointments are in the health portal, secure.health.columbia.edu. They only open 1 to 2 weeks in advance, like I said, so don't worry, you're not going to see August and September appointments right now, but there will be plenty of availability. We will expand capacity as we need to so that you are all able to get your tests when you come back. It is a Monday to Friday operation. If you do arrive on a weekend, you'll have to wait till the next business day.
And let me just add that, in addition, so the site on 168th Street is also open 5 days a week. And test results generally come back sometimes as early as 24 hours, 36 hours, but you're not waiting weeks for your test results. They should be available within no more than 2 days.
Melanie, I think there were a couple questions about seeing confirmation of receipt of your vaccine documentation. Can you talk a little bit about the process and how long, so people are not worried if they haven't yet seen confirmation?
Yes. Don't worry, if you uploaded it last week, you won't yet see confirmation. As I say, processing is taking about 2 weeks at the moment, just because of the volume, because we are checking every single vaccine record. So the two ways to check, the first is in the health portal. If you go in, under your immunizations, you will see if it has been verified. But once we have verified, on a daily basis, we're feeding that information to the app. So once it has been verified, you will see a checkbox in the app. If you have uploaded it through the app, which we don't recommend, we ask that you upload it through the health portal, the checkbox appears right away, but the record still is verified. So if there's an issue with the record, that checkbox will be removed. So the best way to do it is through the secure health portal. And then, as I say, give us a couple of weeks and then you'll see it. But we will get these all done before the deadline.
Okay, and as you just said, because I saw a question about whether or not people have to upload both in the portal and in the app, they only have to do it in the one place in the portal.
Do it in the portal, and if I can emphasize, I know I've said it, but I'll say it again, we need two things, because it's easy. People just put in their dates, but then don't upload their documentation. That will hold up your processing. In fact, it won't be processed. So add the dates, put in the documentation, and only do it once. If you do it multiple times, it just takes us longer to get through the record. So do it once, wait the 2 weeks, and it will be verified.
I see a lot of questions about not being able to find the Reopen CU app. And I think that's related to the fact that in some countries it's not available. So if you're not able to open it while you're still abroad, please don't worry. When you arrive in the United States, you will be able to download the app and see it. And in the meantime, you should use the portal to update information and check the website for updated information. Anything else on that particular thing, Donna? That's correct, right?
Nope, that's correct.
Okay, great. The other thing I'm seeing a lot of questions about is just the quarantining and what's allowed and not allowed while people are quarantining, and how that might run in terms of housing where people are sharing bathrooms, kitchens, etc. I know, Melanie, you've been in touch with facilities quite a bit, so maybe I'll let you address that.
Sure. So in most cases, as I said, you will be able to move into your housing and quarantine in place. So in your regular year-end housing. There's a couple, the only exception would be if you were in a shared room, a double room, in which case obviously you can't safely. So the most important thing when you're quarantining is that you are in your own space, your own bedroom. You can share a bathroom or a kitchen, but just taking precautions, wearing a mask, making sure you're only accessing that space when others aren't in that space. But you can do so safely, and there are certainly web resources that guide you to do that. And then obviously for those who are in doubles, we will be working with Columbia Housing to ensure appropriate arrangements are made there. So you should be able to move in and then do that. A quarantine is really a quarantine. You stay in that space. The only reason to leave quarantine is for what we call essential medical reasons. So getting a test is an essential medical reason. We ask that you don't do your vaccine while you're quarantining. You should complete your quarantine and then take your vaccine after that. So the test you do during quarantine, the vaccine you do after quarantine.
Julie, one thing I noticed a lot of questions about the training, and you do not have to have the Reopen CU app to access the training. The training is available on the COVID-19 website. If you just scroll down from the first page, there's a section called Take Required Safety Training. It'll take you to the link and you complete it. You don't have to do anything on the Reopen CU app. Once you complete it, that check mark will be made for you because we have a record that you've completed it and we load it on the back end.
Great.
And Julie, I know you're going through the questions. I wanted to just say something about those who are arriving unvaccinated, partially vaccinated, or vaccinated with a vaccine that's not approved by World Health Organization. We've seen questions around, will I be able to access campus? So we are going to be doing outreach soon to evaluate how many of our students are in that situation. What we want to do is give you what we're going to call temporary access to campus. We understand that you haven't all been able to get your vaccine or not, or get your second dose or not get an approved vaccine. And we don't want to block you from campus, obviously after you've completed your required travel quarantine. So there will be a process in place where we know who you are, we give you the temporary access, which means we tell the app that it's okay for you to access while you're going through that vaccine process. And then obviously giving you the appropriate amount of time to do your vaccination. So more information will be coming out, We hope within actually this week, we're hopeful, so that you can let us know that you're in that situation. We can make sure we've got adequate vaccine and give you the guidance and the temporary access.
Right. Thank you. Melanie, I'm also seeing several different questions about other vaccines and the documentation required for other vaccines, and how to kind of make sure they're uploading all the appropriate forms. Maybe you can speak to that a bit.
Yeah. So the two requirements outside of the COVID vaccine are for MMR vaccination. That is required for registration. That's a big difference. Your COVID documentation will not block your registration, but not doing MMR will block registration. So that's mandatory because that's a New York State requirement. So you must upload your MMR documentation, and then you must make a meningitis decision, either upload documentation, say you're going to get the vaccine, or decline the vaccine. So MMR and meningococcal are linked to registration. COVID is not. All goes through the same portal, the Secure Health portal. So please make sure you're taking care of all of those requirements.
Excellent, great. And I think you posted at some point in one of the questions, Melanie, if people have vaccine-specific questions, maybe you could put that. And I think that's on the website, obviously, as well.
vaccineinfo@columbia.edu. I will post that in the chat for you all.
Great. I think we've gotten to most questions. I'm sure there are still some others that will keep coming up. We will do another one of these vaccines in another month. We already have it scheduled and planned. So please keep a lookout for that, because we know information is changing continuously. So know that we'll be back in touch. In the meantime, please keep checking the website. Please submit questions as you have them. We will get to them. We are going to, this is recorded, this webinar, it will be posted. And we are going to take your questions and turn them into an FAQ so that we can publish that also on the website specifically for international students, so you can see ongoing and updated information and answers to your questions. So thank you for joining us. Safwan, I'm going to turn over to you to close out, but thank you all for joining us and for your amazing questions. We know there's a lot happening in the world in addition to your transition back to Columbia.
Yeah, thank you, Julie, and thank you, Donna, Wafaa, and Melanie, and thanks to the students for participating, for attending, for your questions. I mean, I think my colleagues will agree with me that we learn more because of your questions, and as Julie said, we're able to fortify sort of the information that we provide to you through FAQs and other means. But as Julie said, keep checking for information, keep checking the website, come back in August for the next session. And again, we hope that we've addressed your questions, and keep them coming, and we look forward to seeing you in September. So thanks, everyone.
Thank you.
Bye.
Thank you, everyone. Have a good day.
Bye.